Professor Dr. Tommy Wood. Thanks so much for joining me today.
Thanks so much for inviting me on and for that illustrious title that you gave me. I
Oh, you
appreciate
gave yourself that.
it.
I was reflecting, and 4 years ago today, I was a jet lag mess visiting you in Seattle when we were working on a startup project together. And
Was it 4 years? Wow.
it's 4 years, I
Yeah.
know. A few grey hairs since then, a lot of lost hair.
Yeah.
A lot's happened since then. And it's honestly been a pleasure seeing you do so much to spread reasonable perspectives on health. And I just want to begin by saying thank you for all that you do.
Thank
And
you.
I'd, of course, love listeners to listen to full episodes of this podcast, but I'm also keen for them to be able to listen just to a few minutes and be able to take away some helpful ideas. And since people seem to remember things that come at the beginning and the end of events better than what comes in the middle, I thought it would make sense to begin with some helpful nuggets of information. And I was wondering, how would you explain the fundamentals of what's needed to have a healthy brain across the lifespan to a 12-year-old?
That's a great question. And the way that I would explain it is probably not that different, hopefully, from how I'd explain it to most people, which is that you have a brain, and your brain is made up of things, and you don't even need to know what it's made up of. It's mainly fat, and a 12-year-old can probably appreciate the concept of that. At least the non-water weight is mainly fat. And if you're going to make something, you need the components that make it up, right? And some of those things can be made locally. You provide some of the building blocks and it turns into those things, or some of those things need to come externally, like you might eat them, and then those things that you eat end up in your brain and provide the structure and function that the brain has. Then if you want to put those components together, you need some kind of stimulus or reason to do that. And so that's one reason why I'm particularly interested in cognitive demand or cognitive stimulus as a critical part of brain structure and function. So you have the building blocks, you have a reason to put those building blocks together, which is the stimulus plus, obviously the genetic instructions, and then you need some kind of support to make that all happen, because it doesn't happen all the time. Maybe that's hormones that get produced, other things that say, yes, it's a good idea to build this brain. Here are the instructions. Here's reasons why you should do it, and here are the things to do it. And then, across those buckets, there are all the various things that you need for a healthy brain, and they're pretty much the same regardless of who you are or where you are in your lifespan.
Great. Hopefully, the 12-year-old had an attention span of at least 1 minute. And if they did, then I'm sure they found that helpful. I'd also appreciate it if you could give some brief brain health boosting recommendations. And the most important of these is surely to tune into Better Brain Fitness, the podcast that you host with Dr. Josh Turknett.
Yes, of course.
But I want to give listeners who, who want a healthy brain from cradle to grave some other recommendations, maybe split by different determinants of brain health. And we can flesh out some of the details later. So maybe trying to keep your answers brief and practical. Can you recommend some brain nurturing, cognitively stimulating activities?
Yes, so you've kind of led me into activities as a major determinant, and we can obviously delve into this further. But regardless of where you look across the lifespan, a critical determinant of brain health is how you use your brain and how you stimulate it. And I liken it to your muscles or your heart with physical activity. It's very similar. You upregulate all these things that stimulate the tissue to remodel and improve its function. It's the same if you're challenging the brain. And that could be education early in life. It could be some kind of rehabilitation, neuromuscular training after an injury, or it could be dancing and other stimulating activities as you get older to prevent cognitive decline, sort of stimulating the brain with those kinds of activities seems to be important, wherever you are in your lifespan. One thing that I think is really important in that respect, and I was having this conversation with a student yesterday who was under the impression that they have to do all their learning before they're 25, because after that the brain starts to slow down and you don't remember stuff as well, and it's just this inexorable decline into dementia basically from your mid-20s. And that is the pattern that you see across on a population level, but it's not true that the brain is unable to learn new skills or develop or improve its function. That is always possible until you reach like the later stages of dementia. So the most important thing, I think, is knowing that your brain can always improve from a function and health standpoint. You just have to give it the environment and the stimulus to do so.
And so, with respect to education, that might be things like reading books, learning languages, including learning to code, and maybe some other things too.
Yeah. So, in terms of early life development, one of the most significant determinants of childhood cognitive outcomes is the environment they're in, and some of that is sort of driven by socioeconomic factors, but things like parents who actively read to them or actively require them to challenge themselves in various ways, like learning to eat themselves as early as possible, creating these stimulating events seems to be critically important. But pretty much anything that fits into the categories of what I would call these sort of human activities seems to provide some additional stimulus. So you mentioned language, that's important. And people who are bilingual seem to have improved structure of the brain, and it's protective from long-term cognitive decline. Music and musical instruments is very important. And then you also mentioned them, and I mentioned them briefly, these sort of, and it was actually you who sent me a paper on this idea of open skill versus closed skill movement, and open skill things basically being something that requires you to react to the environment or has some additional motor component. So things like dancing, things like badminton, table tennis, something where there's an unexpected aspect that requires you to react, or has a more complex motor component. Above and beyond the benefits of the physical activity, there seems to be an additional benefit to the brain. So, learning to climb trees and skateboard and all those kinds of things as a kid, there's going to be greater cognitive stimuli that are probably going to be, more beneficial for the brain, in addition to the physical activity side.
Cool. And on the subject of physical activity, any specific recommendations regarding different types of activity that you haven't touched on? So I'm thinking of things like resistance training, endurance training, and having adequate cardiorespiratory fitness.
All of those components become important. And obviously, people like to think about, what's my optimal structure of all the exercise that I should do. And I think in some ways you can tick multiple boxes in one go. So, you do things, something like yoga training. It obviously has a strength component. It has a motor skill component. If you're doing some of those, like dancing, has a cardiovascular component as well as a motor skill component. But on top of all of that, we can look at individual studies, randomized control trials that looked at individual components or types of exercise and how they affected the brain. So I think it was the first study that showed that in adult humans you can increase the size of the hippocampus, which is an area of the brain in the medial temporal lobe that's very important for memory, as well as emotional regulation. And it's an area of the brain that specifically becomes damaged or atrophied, gets smaller as we get older and we transition into periods of cognitive decline or dementia. The first time we saw that you could actually increase the size of this area of the brain, and it's not necessarily that you're growing new neurons, you're probably improving the structure and the blood flow and all these other components that make up the volume of that area of the brain, was with a walking intervention. This is published in PNAS in 2011, and they randomized people to 40 minutes of brisk walking 3 times per week for a year, and they saw that in that group, compared to a stretching control group, they saw increases in the size, the volume of the hippocampus on an MRI scan. And with that, those who saw the greatest improvements in cardiovascular fitness saw greater improvements or greater increases in the size of the hippocampus. And that was also correlated with increases in something called BDNF, brain-derived neurotrophic factor, which is one of those support things I mentioned earlier. A whole bunch of things are produced by the body that support or promote growth and function of areas of the brain, and BDNF is one of those things. So back then, we knew that just brisk walking, some low-level aerobic exercise with improvements in cardiovascular fitness then was associated with improvements in brain structure and function. And there have been other studies that looked at something similar with resistance training. So there was the SMART trial that was published a few years ago that randomized people to either cognitive training, like an online computerized brain training, or resistance training, or both. And they saw that those who did resistance training had improvements, particularly in the white matter, which is the sort of part of your brain that's underneath the cortex, and it's responsible for all the fast connections between different areas of the brain. And they had improvements in both cognitive function and structure of the white matter. And it was a very simple setup. It was 3 sessions per week, 6 exercises. So like 6 machines at the gym, 3 sets of 8, like a very basic bodybuilding style protocol. And that was associated with improvements in cognitive function. And both of these studies are in individuals in their 60s to 70s. So these improvements are possible even later in life. And then you get improved cognitive benefits alongside that.
When you are someone who's got a PhD and an MD and a postdoctorate, for a short answer, sometimes you get a
was that supposed to be a short answer? Yeah, sorry about that.
But it's all good stuff. Okay, so returning to short answers, What about nutrition? So just maybe 2 or 3 simple things that people can apply if they want to improve their brain health.
One of the most impactful interventions for brain health from a nutrition standpoint is ensuring 2 things: adequate supply of omega-3s and adequate supply of certain B vitamins. And there are several now randomized trials that show that if you have both, you have a significant improvement in brain structure and function. But if you don't have one or the other, you don't get the same benefits. So they have a synergistic effect. So we're talking either some kind of supplemental long-chain omega-3s or just eating fish relatively regularly, maybe once or twice a week. And then from a B vitamin standpoint, we're talking B12, folate, B6, riboflavin. You can get these either from things like meat or liver, which is probably my favorite. But you can also, some people may need to supplement depending on their base diet, and that's fine too. The studies that show benefit come from supplements rather than from food, but you can get them from food as well. But those are the things that, the most important things I would focus on. There are, of course, others that we can get into later.
Liver being your favorite, that's the Viking in you coming out. What about biological rhythms, and in particular circadian rhythms? So these 24-hour processes in our bodies optimize our bodies according to time of day.
Yeah, I know somebody who knows a little bit about that. I think he's called Gregory. I know that's one thing that you're really an expert in. But yes, of course, this is incredibly important, and probably from 2 different standpoints. One is that we know that if people are dysregulated from that standpoint, shift workers, things like that, that's associated with multiple potential issues with, say, blood sugar regulation, increased risk of type 2 diabetes. Those predispose us to dementia and cognitive decline. And then one of the most important, if not the most important, supportive process for building aspects of the brain or new connections is sleep. And like with exercise, you don't get stronger when you do the exercise, you get stronger in the period of recovery, and the brain is the same. So you stimulate the brain, then you need a period of sleep to then allow those new connections to be made. So having a regular structured sleep pattern is going to be very important to support brain health long term.
What about social integration?
That's also very important. There are studies that show a protective benefit of being socially supported or feeling socially supported, and in many respects it's subjective. Do you feel socially supported and have a good network? And what that means for each individual is very different. That's protective against cognitive decline, whereas those who are socially isolated or feel lonely do not feel like they have adequate social support. They have an increased risk of dementia and cognitive decline. And then if we think about some of the interventions that may tick multiple boxes, we talked about dancing earlier. I think that's maybe an ideal one because it has it's physically strenuous, it has a complex motor component, and you usually have to do it with somebody else. There's a social aspect as well, and you're probably covering multiple bases at the same time. But equally, any kind of activity that has you going out and spending time with people you enjoy spending time with is going to be important.
Okay. Stress management practices.
That's another aspect of this support idea. What's important to support the health of and structure of the brain. And one way that I think about it is that chronic stress impairs the ability to rest and recover, and that can either be from a hormonal standpoint or from the way it activates the nervous system. It moves you away from this period of rest and recovery. And there are now several studies that show things like mindfulness training, meditation, maybe certain aspects of breath work. These can down-regulate that stress response. And then if you randomize people to do it, it can be associated with improved structure and aspects of cognition in the brain. So again, it's very different from person to person what they might find sustainable, that they enjoy doing. But some of those practices are also going to be very beneficial. And I think of that as sort of removing or improving the ability to recover from a cognitive stimulus to then allow the structure and connections in the brain to be boosted or improved.
Okay, last one, and we'll get to the details of this later, but there is some research showing that exposures to things like certain toxins and getting certain infections is associated with increased risk of brain dysfunction down the line. So with that in mind, what are some things that people can do to reduce their exposures to some of those damaging influences on the brain?
Some of the most common ones are pretty obvious. Smoking being one that is significantly associated with cognitive decline, and it's not linear, but it's definitely correlated. So the more you smoke, the higher your risk. Air pollution is another one that's increasingly studied, and that can be more difficult for people to have control over. Not everybody is able to move away from where they are, and air pollution is intricately linked to socioeconomic status because you put roads next to people who don't have as much financial or social capital to prevent that from happening. However, there's an interesting study here that showed the effect of air pollution was greatest in those who had the lowest B vitamin status in terms of dementia. So again, some of these things interact. Maybe you can improve your resilience with some other things if you're not able to distance yourself from air pollution. And then another important one, like you mentioned, certain infections. There's some evidence that infections can either track from the nose into the brain or from the teeth into the brain, potentially, or even if they're not inside the brain, the inflammatory response can trigger or be associated with cognitive decline. So I think the most important thing is go see a dentist and make sure you don't have any significant gum disease, which seems to be associated with dementia for that reason.
Superb. Okay, so those were our very rapid fire opening questions. We're now going to just think about brain health across the lifespan. and maybe move in reverse chronological order just because most people tuning in are likely adults.
Yeah.
And with that in mind, briefly, how burdensome do you think some of the most common brain disorders are? And into that category, we can put both neurodegenerative conditions and mood disorders. I know that you focus mostly on the former, but maybe
Mm.
just touch on some of the more common ones.
Yeah, they are both burdensome and very common. Um, and depending on where you look, potentially the majority of individuals will either experience some kind of neurodegenerative condition or regularly experience symptoms associated with mood disorders such as depression or anxiety. It doesn't mean that you get a formal diagnosis or you require medication, but those feelings are certainly very very common, and they're also associated with one another. So being diagnosed with depression is associated with an increased risk of later dementia. Um, so, anything that we can do to better support these brains and have one not lead to the other, I think is critically important. In terms of the burden, antidepressants are one of the most common prescription medications that are chronically prescribed other than the oral contraceptive pill. Um, and when we look at the burden of dementia, there's these projections that it's essentially going to double or triple in the next 2 or 3 decades in terms of the number of individuals living with dementia. And primarily, this is Alzheimer's disease or Alzheimer's dementia. There are other forms of dementia, but that's the one that I think most people are sort of worried about or interested in. And what's nice in one way is that age specific incidence of dementia has decreased, and that's decreased as we've increasingly focused particularly on cardiovascular risk factors. So managing people's cholesterol, managing people's blood pressure, that seems to be improving the risk of dementia at any given age in an individual, although the effect seems to be greater in men than in women. And that's an issue because only about a third of those with Alzheimer's disease are men. So it's just on a smaller fraction of those at risk. But as the population ages, there's still going to be this increase in risk of dementia, or total number of individuals with dementia. So there are some people who say that dementia or Alzheimer's disease is going to bankrupt healthcare systems around the world within the next 2 or 3 decades, unless we find a way to really decrease that burden.
Those are the optimists. Just out of curiosity, you mentioned the focus on cardiovascular health. Then, has there specifically been a reduction in the vascular subtype of dementia, just given the heterogeneity between these different types of dementia, or is that not something that you have at the fore of your mind?
That it seems to be the case. However, knowing the significant vascular component of Alzheimer's dementia that is a significant risk factor, there's so much overlap that I think if you just look at dementia broadly, we see that the age-specific incidence is decreasing, and this seems to be associated with improvements in things like blood pressure treatment. And there are some studies that done in the UK that have tracked populations longitudinally, and that seems to be the case. When you talk about dementia, vascular dementia has specific vascular dementia has this very stereotyped progression where it's supposed to be stepwise. So you have some small infarct in some area of the brain, some blood clot that stops blood going to one area of the brain, and so you lose function rapidly in steps. Whereas in Alzheimer's disease, as we think of it currently, it's more of a steady and heterogeneous, slightly random stochastic decline. However, there's a significant vascular component to that, so it's difficult to separate them out. But it definitely seems like improving cardiovascular health, which has been a big focus of the medical healthcare systems in the last 5 decades or so, seems to be translating to some decreased risk of dementia, though obviously not enough, or as much as we would want it to.
You mentioned differences between biological sexes there, and I understand that postmenopausal women comprise about 2/3 of Alzheimer's disease patients, and
Yeah.
some people believe in this so-called estrogen hypothesis. So I was just wondering, what do you think about the potential for hormone replacement therapy for addressing brain dysfunction in postmenopausal women?
I think it's going to be very important. There is quite a lot of work that suggests that the hormone levels at the menopausal transition or after the menopausal transition, particularly estrogen levels, are critically important for long-term cognitive function in women. And this is another one of those trophic factors that I mentioned earlier, things that support brain health. And both estrogen and progesterone have important roles to play there. As we sort of swing back into an era where hormone replacement therapy is considered potentially beneficial, because after the Women's Health Initiative study, there was this big outcry that maybe it was going to be detrimental. If we treat early and women have, they don't have a significant burden of other, say, cardiovascular risk factors, then I think there's a big benefit to be had from bioidentical or other hormone replacement strategies, and that's probably going to be really important for long-term cognitive function.
So if we think about adolescence, then some of the biggest killers in this group include things like accidents, violence, and self-harm. And that, of course, points to the importance of brain health in this age group. What's your impression of how adolescent brain health is changing over time?
There's lots of things that go into this, and there's the the physical damage aspect, as you mentioned. So kids and youth, adolescents play a lot of sports. There's millions of concussions that occur in youth sports every year across multiple countries. It's the same in the UK and the US. And as far as we know right now, although some people debate it, though I don't think it really needs to be debated, but some people debate it, but an accumulated exposure to multiple, even a single, but probably multiple concussions over that developmental period is associated with worse long-term cognitive outcomes. So there's that aspect. But then, as we think about the adolescent brain, there are other important things that have changed in the last few decades, like social media and, say, computer games or screen time. And something that I get asked about a lot is, is screen time bad? Are these computer games bad for the brain? And we can maybe focus on that first. And I think the highlight answer is those things are probably only detrimental if they're being performed or they're being done such that you're ignoring other aspects that are important for brain health. So there are studies in children where those who play video games for on average 3 hours per day have improved or better cognitive function than kids who don't in a similar age group after stratifying for multiple confounders. And they often look at things like working memory and executive function, something like a go no go type test. And when you look at interventional studies, if you expose somebody to an increasingly complex video game, that's also associated with improvements in those cognitive functions. So comparing solitaire to Tetris to like Super Mario World 3D, you see graded improvements in cognitive function with increasing complexities of video games. So I think there is definitely space for those kinds of things to be important cognitive stimuli. Just they're new, but can be beneficial. However, if you get to the point where you're playing them 14 hours a day and you're sacrificing sleep or a nutritious diet or physical activity or time outside or social connection, then I think that's where it becomes problematic. When it comes to social media, obviously there's a whole bunch of stuff that we could get into, but the thing that I find most interesting is this idea of social comparison, which is potentially problematic. And I recently guest edited a special edition of the Lifestyle Medicine Journal that I'm associate editor of for Wiley. And one of the papers that we had is from George Slavich and his colleagues at UCLA, and they look at human social genomics, like how does the human biology and physiology respond to their social environment. And this is particularly related to things like social isolation. However, what you see is that those who feel threatened socially, particularly when you're comparing yourself to others, that's where the biggest effect is. And that's obviously what we do on social media, all this, every day. You're continuously comparing yourself to others. It's potentially making you feel like you have a lower social status, lower social rank. You're obviously, you're not good enough, smart enough, fit enough, all those kinds of things. And that's associated with increased inflammatory responses, activation of the sympathetic nervous system, these kind of stress responses, and then that's associated with poor health. So it doesn't have to be, and that's a more important determinant than, say, household income or other socioeconomic factors. So it's the subjective feeling that you have of your social status compared to others may have a bigger effect than sort of some of these harder things that we can measure. So I think that's where social media may potentially play a role in terms of negative health or brain or cognitive outcomes.
Last time I played a computer game, it was Sega Mega Drive, circa 1994. Were you an N64 guy?
Yeah, absolutely.
Yeah, so I think the 1994 Sega Mega Drive plus me having approximately 30 followers on TikTok means that I'm absolutely doomed. But that's okay. Just thinking about your academic research, most of it focuses on neonatal brain injury. What are some of the common causes of brain injuries in people of that age? And how prevalent and burdensome are they?
The two most common causes are the two ones that I spend the majority of my time researching, both with animal models in the lab as well as with clinical data as part of clinical trials. And the most common is preterm birth. So being born too early, essentially. And the more preterm you are, the greater your likelihood of either dying or having some kind of significant neurodevelopmental impairment. In the US, currently 10% of babies are born preterm, and that's anything before 37 weeks gestation, if normal gestation or normal pregnancy is 40 weeks. And, within, the sort of the 34 to 36 week category, usually kids do just fine. But then right now, what we consider the limit of viability, like how preterm can you be born, and a good neonatal intensive care unit has the capacity to resuscitate and maintain, keep you alive. That limit is currently around 22 weeks, which is obviously extremely preterm. And if you go down to that, to that level of prematurity, it's obviously a much smaller fraction, fractions of a percent, maybe 1 or 2 per thousand. However, those have, more than a 50% chance of either having some significant neurodevelopmental disability or dying. And then you have a burden of learning impairments, cerebral palsy, all these kinds of things. So it could be motor, it could be language or cognitive or both. And that is burdensome both for the individual but also the healthcare system. And we're working very hard, although we don't necessarily have a lot of answers right now. We're working very hard to try and develop therapies that we can give to these babies early on to try and improve their brain development, because then most of the brain is developing outside of the womb rather than inside where it would normally happen. So it's just a very different environment in which the brain is developing. One important thing there is that in babies born preterm, even if they have some kind of injury in their brain, and we can see that with like an MRI scan, the environment they go home to is critically important, and maybe more important than what's done in hospital up to a certain extent. And there was a study done by Stephen Miller, who's this one of the experts in terms of imaging the newborn brain, where even if you had some kind of significant brain injury, but then you were discharged to a home where your mother had a graduate degree, so this is as some measure of socioeconomic status, then that brain injury didn't mean very much in terms of your developmental trajectory. And obviously, education state, like maternal education status, is a proxy for income and access to a whole bunch of important things, including nutrition and support, and as well as a relative absence, probably, of discrimination and those kinds of things. But there was this sort of separation in terms of how those kids developed based on the home that they went to. So even if there is some kind of early brain injury, we can overcome that by the child being in a supportive, nurturing environment. And in my mind, that means that those who have less easy access to that should be provided to them by society, and that's where I think we could sort of like raise that level up. That would be the goal. So that's one area, and then the other one is babies who get to have a normal pregnancy as much as we know, and then right at the end something happens, and this could be a sudden, what we call sentinel event. You can get like the uterus ruptures, or there's some issue with the umbilical cord. Something happens, and blood flow and oxygen are decreased to the brain, and then as a result, you get this disordered brain function that we call hypoxic ischemic encephalopathy, or neonatal encephalopathy of suspected hypoxic ischemic origin. That's what people are calling it nowadays. And this is the other thing that we model in the lab, and I work on some clinical trials with. And this is less common, maybe 1 to 5 per 1,000 experience this kind of event, and then 25 to 50% of them need really intensive care. And then the standard of care is therapeutic hypothermia. That's what I did a lot of my PhD on. We cool these babies down for 3 days, and this is neuroprotective. It decreases the rate of death, decreases the rate of disability, but it's not it's not a panacea. There's still a significant proportion of those babies, maybe 30 to 40%, who have an adverse outcome, and that's kind of what we're targeting with our new new research.
Do you selectively call certain body parts, or do you just call them at large?
There's actually been a lot of research in this area. One of the first trials was called the Cool Cap trial, and it did what it says on the tin. They cooled the baby with a cap with some systemic mild hypothermia. But now it seems that the best approach is probably systemic cooling. So you cool the body. And then the reason why that's probably better is that rather than cooling from the outside in, and a lot of the injury pattern in these babies is often in the deep brain, in the deep gray matter, things like the basal ganglia and the thalamus. And so what you want is cold blood getting up into the brain rather than being cooled from the outside. That works as well, but it's peripheral cooling the body is probably the better strategy, and that's what's more common nowadays.
And you've looked at various different types of interventions that have been thought to attenuate the effects of brain injury, everything from EPO to exogenous ketones to vitamin E supplementation. Which of those have proven effective when translated to humans, if we know that? And also, as you look to the future, are there any particular interventions that you think are especially promising, but right now relatively underappreciated?
The one that I can say we have the best information for is EPO, or erythropoietin. This is a therapy. So if people don't know, it's produced by the kidneys. It supports red blood cell production, but at higher doses, it is thought to have neurotrophic effects. So it can like directly bind to receptors and support neuronal regeneration, as well as having some anti-inflammatory effects. And my postdoc supervisor, who's still a very close colleague of mine here at the University of Washington, She basically took EPO from very basic science studies through to large animal studies, through to pilot studies in humans, through to now multiple large multi-center randomized controlled trials, which are basically the current gold standard in terms of how they will run of randomized controlled trials in this population. And EPO was not neuroprotective in these babies as an adjunct to hypothermia, despite very good evidence at every stage up to that point. One thing that we're now potentially thinking is that because they have overlapping mechanisms of action, using EPO on top of hypothermia, which is the current standard of care in high income settings, is maybe, it's maybe counterproductive. So there are other settings, particularly lower middle income settings, where the typical brain injury pattern and type of injury that these babies have is different. We now have some evidence to show that hypothermia probably doesn't work in that setting. So that's a setting where EPO may be beneficial, where hypothermia doesn't work, and therefore it could be beneficial in those trials that are currently running. Then there are a whole slew of other things that could potentially be beneficial. We've looked at vitamin E in our we have some in vitro like test tube brain slice models that we use. I collaborate with my wife on those. Vitamin E is very neuroprotective there. There are other things like caffeine seems to be really protective. And caffeine is used in almost all preterm babies, and that's associated with improved outcomes. It's used to stimulate respiration. It's used to prevent something called apnea of prematurity. But along with that, it also seems to protect the brain. So pretty much every baby born preterm gets caffeine. In this other setting, term babies with some kind of acute injury, it's less commonly used, but it seems to be protective. And I think that's probably going to be one of the ones that I'd say has a lot of promise. It's already used in babies. We know it's very safe. We just have to do the trials in that particular population. One thing that you mentioned is something that I'm very interested in is ketones. And I think that that's relevant to a whole range of brain injuries. There's some studies in those with cognitive impairment or dementia where, supplemental or exogenous ketones or sources of ketones like medium chain triglycerides seem to be associated with improvements in some aspects of cognitive function. And then I think the same could be said for things like traumatic brain injury. And there's a lot of research currently in terms of either protecting the brain in those who are at high risk of traumatic brain injury or a blast injury or a concussion. If they have some ketones on board, does that improve their outcomes? And those studies are currently running. But in the neonatal population, that's probably the population where I think if ketones are going to be shown to be beneficial in large randomized studies, that's maybe a population where I'm really interested in looking at that, because the neonatal brain, is used to running on ketones. It uses ketones both as a metabolic fuel, but in utero and then in early postnatal life. But then ketones are also preferentially used. And one way that it happens is there are medium chain triglycerides that are produced specifically in breast milk. When the baby consumes those, they produce ketones. And then in the brain, those ketones seem to be preferentially used for structural building structural components. So they turn those ketones into fats and cholesterol to create the structure of the brain. So in that setting, if you have some kind of brain injury, in my mind, it makes a lot of sense that ketones would help to support repair and recovery of a brain injury in a baby, because that's how they normally sort of create brain structure. However, at this point, it's still very speculative, and those studies haven't been done. And I look forward to them, maybe happening in the next few years.
And maybe contributing to them. And this is not something that I've looked at personally, but I understand that Javier Gonzalez and some of his colleagues at Bath recently found that giving people exogenous ketones increased EPO levels. So I wonder if there is some overlap between them. But anyway, I was just wondering whether there's any evidence that the effects of brain injuries could be transmitted to subsequent generations. It's probably a difficult thing to study, but do you have any thoughts on that?
It's a great question, and I don't know if we have good evidence for that. I don't even know of any good animal models where, say, they've, created a brain injury and then had those animals, looked at their subsequent offspring. It's certainly a study that could be done, or if it's been done and I just haven't seen it. But we do know that there is potential for these things to propagate along generations. And so if you're exposed to some kind of systemic stressor, which of course a brain injury would be included as one of those, that can have epigenetic effects that translate across generations. And this can be seen in animal studies, but equally, I think we see some evidence for this in humans as well. And this is particularly relevant to societal or social stresses. And the when you look at this in animal models, if you have some kind of social defeat model or something like that, where a chronic stressor is applied, then this results in a big inflammatory response. There are issues. So say if this is with a pregnant dam, say a pregnant mouse or rat, this then translates to worse outcomes in the pups. And in humans, we know that in the US, at least, and it's certainly the case in other countries as well, that Black mothers are much more likely to have babies born preterm. It's about 3 times the rate of white mothers. And there's some studies that suggest that the amount of discrimination that a mother is exposed to is that, then increasingly predisposes her to having a preterm birth. So we then also know that adults born preterm have what we call, or what I call, an accelerated aging phenotype. They die younger, they have more cardiovascular disease, they have more type 2 diabetes, they have more strokes. And if you look at things like their epigenetic biological age or things like that, they just look older biologically compared to people born preterm. And so there's this idea that these chronic stresses are being propagated across generations, right? You have an increased risk of preterm birth that is associated with all these epigenetic changes that are associated with that kind of inflammatory stress response that results in a greater likelihood of a more accelerated aging inflammatory phenotype in the offspring. And this seems to be propagating down generations in humans as well. And of course, some of this is sort of hypothetical, looking at what we have just from observational studies, but it certainly seems that what we see in some animal models, is happening in humans as well. And so some of this stuff can be translated across the generations.
Keen to speak a little bit more about your demand model, and it's garnered quite a lot of attention. Joe Rogan seems to be a fan. That's great. And I was just wondering if you could just briefly flesh out your demand coupling model, just clarify it in the minds of listeners.
The idea goes back to something I mentioned briefly earlier, which is that the function and, in some respects, structure of a tissue in the body seems to be directly related to the stimulus you apply to it. And the easiest way for people to think about it usually is with respects to exercise. So Dr. Josh Turknett and I, we have a paper where we outline this model, and we talk about the parallels of exercise multiple times, because I think it's something that people can sort of wrap their minds around. And so if you're trying to get bigger or stronger or faster or fitter, we know the most important thing is that you do the exercise, you do the stimulus, you go for a run, you lift the weights. You can support that process with good diet, good sleep, good hormonal status, right? All these things are important. Avoiding toxic exposures like smoking. But if you don't have that initial stimulus, you're not going to improve your fitness or the size or strength of your muscles. And the brain essentially seems to be the same from the way that we see it. So imagine a scenario where you have the perfect diet, you sleep great, you have great social connection, no toxic exposures. If you don't go to the gym and lift weights, you're not going to get bigger and stronger. And the same we think applies to the brain. So we talked about multiple risk factors: social isolation, nutrient status, sleep, chronic stress. Those are all important for maintaining long-term brain health. But if you want to improve the structure and function of the brain, you probably need to stimulate it. You need to give it some kind of novel demand that it can then respond and adapt to. And so that's essentially our idea, that the primary driver of the structure and function of the brain is how you use your brain, how you stimulate it. And then all the other risk factors are related to either supporting the response to that stimulus or preventing actively detrimental or harmful processes. But cognitive demand being this sort of the primary thing that's probably sitting above all of that.
I suppose the one exception to your point about growing bigger, stronger muscles is taking heroic doses of anabolic steroids. But that's a conversation for another day. Can you maybe tell us a bit about the neuroprotective effects of different types of cognitively demanding activities? I know that you like speaking about taxi drivers, for instance.
Oh, yeah.
Maybe give us a couple of examples.
Yeah, there's, I think, a lot of evidence now that says that either significant changes in your cognitive demand or cognitive stimulus are associated with significant changes in the trajectory of the structure or function of your brain, and it goes in both directions. So we talked about earlier how a brisk walking intervention significantly improved the size and structure of the hippocampus. We've seen similar things with dancing trials, randomized controlled trials of dancing versus circuit training. But then one of my favorite studies is this study published in Current Biology, where they looked at taxi drivers in London. And back in the day, I don't think it's needed anymore, certainly not in the day of like rideshare apps. But back in the day, if you wanted to be a black cab driver in London, you had to learn the knowledge. And the knowledge is essentially memorizing a map of 25,000 streets in a 6-mile radius around Charing Cross Station in central London. And they followed individuals who were training for the knowledge. And these were in their 30s, mid 30s on average, or there was a spread. And what they saw was that it takes 2 years to learn the knowledge. And so over this 2-year period, they looked before and after on MRI scans. Those who successfully completed and passed the exam had a significant improvement in the structure of the brain, particularly around the hippocampus. That's important for memory, like we talked about already. Those who failed, their brain looked exactly the same after 2 years, and then they had a control group who didn't do anything in relation to the knowledge, and their brain also looked exactly the same after 2 years. So in those individuals who managed to stimulate their brain enough, maybe they did more practice or better practice, better memorization, and were able to significantly harness that area of the brain. They saw improvements in structure in that area of the brain, and then function that came with it. What's interesting is that the brain is certainly capable of this hyper specialization, which is what's being asked of in that kind of training. But they also saw some decreases in other aspects of cognitive function, probably because they're channeling so much of their resources into that specific type of task. So I liken it to a powerlifter who is just trying to get stronger in a deadlift or a squat or a bench. In order to specialize in those movements, you're probably going to sacrifice some cardiovascular fitness or other aspects of your fitness, right? If you want to become an absolute expert in something. At a physical level. I think the brain is the same, right? You can't be the best in the world at everything. So we know that the brain can respond to these very specific stimuli, even later in life. That comes with improvements in structure and function. But if you really hyper specialize, maybe you're sacrificing some other aspects of cognitive function. So as with most people, I would say it's better to be, as with physical activity, I'd say it's better to be a generalist. Do some resistance training, do some cardiovascular training. Be a little bit good or a little bit better at everything. And so then, if you think about this from the brain standpoint, yes, some tasks are important that are related to memorization. That's important, but then also some of these complex multifunctional tasks like music and language and complex motor skills. A bit of all of those is probably going to be beneficial, so you can sort of generate stimuli across the brain. At the other end, one thing that I talk about frequently is that when we lose a stimulus, that's associated with acceleration of cognitive decline. And there are a few different examples of this. And importantly, they seem to be reversible. This is something you can actively fix or change. So that probably the easiest one to look at is retirement. And there are several population-based studies that suggest that after adjusting for confounders, because say if you have a medical condition that forces you to retire early, that medical condition may also be associated with increased risk of dementia. So you have to take that into account. But those who retire earlier seem to experience cognitive decline earlier. And that's probably because the modern day work environment is the place where we receive most of our cognitive stimulus. And unless we replace that in retirement with other activities that are equally stimulating, we lose that stimulus and we lose cognitive function with it. More specifically, we know that if you lose something like a sense, so if you lose sight because of cataracts, or you lose hearing with things like presbyocusis as you get older, that's associated with accelerated cognitive decline. In both of those cases, if you add hearing aids or cochlear implants if you need, or if you do cataract surgery, you reverse that risk. So removing that stimulus, which these senses are continuous stimuli for the brain, removing them is associated with faster cognitive decline. But if you replace them, that risk is no longer there. So again, I think that says that the brain is adaptable to the stimuli pretty much at any age, because these are obviously individuals in their 60s, 70s, 80s. If you maintain that stimulus, you maintain cognitive function, or you can reverse the risk of cognitive decline.
Yeah, the example of vision is an interesting one, because I know there's some work on people who have had surgery for cataracts showing that when they've had that surgery, you also see improvements in circadian system function and sleep, for instance. And that brings up the subject of what mediates the positive effects of different interventions and stimuli on cognition, because sometimes you might think it's one thing, actually there are lots of different things going on. I suppose that's probably almost always the case.